Is there anybody here who's had dengue themselves? Aside from me, you. It's a very horrible disease when you suffer from it. And it certainly made me very ill. And I don't know whether I had a primary infection that wasn't detected, but the secondary infection was extremely severe. So I think we do need to try to control dengue. And these are some very pretty little fish that have been used for quite a long time in other places to control both dengue and malaria mosquitoes. When I was in India once, when I worked with MSF, I went to the National Malaria Control Program and they had tanks and tanks of guppy fish. So I don't know whether they were distributing them or not, but this is about a study we did in a rural area of Cambodia, and it's addressing the challenges, opportunities, and community acceptance of a dengue control methodology. Okay, so we did some studies in Cambodia looking at the insecticides that are being used at the moment by the vector-borne disease control program. And we found that Temethos, which is called a bait normally, has high levels of insecticide resistance as well as permethrin, deltamethrin sprays. So the evidence of their effectiveness in controlling Aedes mosquitoes was very low. So we decided to do a randomized controlled trial in some villages in Kampong Cham province, which has one of the highest dengue incidents in Cambodia. And the design was that we had 3 arms. One was with guppies plus this pyriproxyfen impregnated disc. They're quite small, about this size, and they can go into small containers, plus an intervention for community mobilisation called COMBI. So the second arm had the guppies plus COMBI, and then the third arm had a control. And in each arm, there were 10 clusters of approximately 200 households in each cluster. So we targeted the big water jars where people store water. And as somebody mentioned earlier on, water is very precious, so you can't keep emptying the water jars and cleaning them out because people need to keep the water stored. So we had put the larviferous fish into the biggest water jars, which held more than 50 litres, but there were lots of small water jars and containers with plant pots, etc. And into those we put the pyriproxyfen. And there were about 10% of the small containers and 90% of the large containers. And then the communication for behavioural impact was done in around all the jars. So this was how we used community health volunteers. And in Cambodia, all villages have community health volunteers, as they do in Thailand. And they are real volunteers, and they do various health promotion activities. They receive sometimes some travel expenses to go and report to the health centres, but otherwise they're not paid. We also set up in the health centres a guppy bank, so that guppies were bred at the guppy bank, and the community health worker could go to the guppy bank and get the guppies and take them to their households and put them into the jars, and also deliver health education at the same time, or how to look after the guppies and the reason why the guppies should be there. So the methods that we used, there was an entomological survey looking at every 3 months to look at adult mosquito collection, larvae and pupae collection, looking at how many containers there were around the villages, and this premise condition index. There was also a baseline and endline survey looking at knowledge, attitudes and practices around mosquito control, the acceptability of both the pyriproxyfen and the guppies. There were adult emergent inhibition assays, and community health workers monitored the coverage of guppies and the PPF in the containers. So this was the results of the mean number of adult Aedes females per cluster per arm and survey. So if you notice, during the light rains, the control containers had a lot more adult females coming out than in the where those were guppies or the pyriproxyfen. These were the number of pupae that were found again, the control arm had a lot more than in the other arms. And this was the percentage of water containers that actually contained guppies or actually the PPF. So when people were asked what were some of the challenges in keeping the guppies and the pyroproxyfen in the containers, the guppies were sometimes eaten by other predators like green frogs and lizards. People use the water for washing themselves, and they often take a big load of water and pour it over their head so that guppies could be lost in that way. Children like to play with the guppies, so they'd take them out and play with them because they are very pretty little fish. The animals would often drink from the water containers as well, and therefore the fish got eaten. The people fed the guppies with rice husks, which were commonly available in the community, but sometimes they gave them too much food, or they gave them different food, which was the wrong kind. They found that the jars needed to be in the shade because the guppies got killed if it got too hot. There were concerns from the population about putting chemicals in the water, and that's one of the reasons why Tomephos doesn't work very well either, because although the government hands it out to everybody when they're thinking about dengue before the dengue season, people don't like to put chemicals into their water. And a lot of older people who are strongly Buddhist didn't want to kill the mosquitoes anyway, because in Buddhism, of course, you're not supposed to kill anything. These are some of the results of the qualitative assessment. Use of village volunteers is very useful for conveying information because they come from the community trusts them, and the community likes to get this information face to face, and they can ask questions and they can bring up topics, which if you just deliver health education to people, they can't always ask questions and they can't feel comfortable. The volunteers explained the use of the guppy fish and the PPF nicely, and they conducted regular follow-up to check on the guppies and bring new ones if there was a problem. The community members particularly liked the tuk-tuks, which are small vehicles that go around, and they had music and singing and songs and posters, so they really liked that approach. They liked the pamphlets and the posters, but they thought there should have been more and that every household should have one. They didn't like radio and TV because it just tells them things and they can't sort of discuss it or question it. And they wanted more posters to hang on their houses. These were some of the other COMBI activities. So there you see the tuk-tuk in the corner there with the information hung on the sides. They also had community discussion meetings where people could sit down and discuss what are the problems around dengue and health seeking and all the others, and there were leaflets. And then in the schools they drew pictures of their village and where the larval breeding sites were and what the reason for the guppies were. So the conclusion of this study was that guppies can be effective for Aedes control in Cambodia. And they've also used different type of mosquito-eating creature in Vietnam. And somebody brought up with, does this have an effect on dengue incidence? And in fact, in some of the areas of Vietnam where they used the cyclops creatures, they found that there were no dengue cases being reported from those villages. So it does appear that it can be effective. There are low cost. This is a low cost intervention, and when there are challenges, they can be overcome by engaging the community to find their own solutions to those things. And these COMBI activities need to be carried out. You can't just do vector control. We know that we've handed out loads of nets and people don't sleep under them, for example. So that actually having community-based interventions to help people control their behaviour and find out why people don't do the things that we want them to do, and try to let communities come up with their solutions is very important. So at the moment in Cambodia, already in January, 1,000 cases of dengue fever had been found, and that is even before the dengue season had started. So actually, dengue in Cambodia is becoming a more and more serious problem, whereas malaria is now quite a rare problem, confined really to mobile and migrant populations who go into the forest. And the dengue control program is really trying to raise public awareness about dengue as a problem. So in the future, the Malaria Consortium, we are getting a grant now to try to scale up the guppy program across the whole of the country, and hopefully that grant will come through. We're also doing some socio-ecological studies with school children, which is trying to get school children to be able to identify the Aedes mosquitoes, to how to breed guppy fish in the school, make homemade mosquito traps and bring home information to their families. And somebody was talking about contact tracing and going back to households and tracing contacts. I think that's really important. So we'll see what the results of those studies are. One is funded by TDR and the other by a Norwegian university in Myanmar. It's called the My Schools Project, and it will be in Yangon, which is an urban environment, which will be very interesting to see how that works. Thank you.